September is Ovarian Cancer Awareness Month. According to the American Cancer Society, nearly 22,000 women in the U.S. will be diagnosed with it this year. Ovarian cancer often goes undetected until it has spread to the abdomen or pelvis, with 75 to 80% at stage 3 or 4. In HealthBeat 4, KTIV's Michaela Feldman breaks down the different types and explains what to look for.
About 1 in 78 women will develop ovarian cancer in their lifetime. And while it's most common in women 60 and above, younger women can also develop it. Dr. Donald Wender says there are several types of ovarian cancer.
But by far the vast majority are either adeno or serous cancer that starts in the ovaries, commonly spreads to the uterus and within the abdomen.
So what should you be looking for? Unfortunately, Dr. Wender says the symptoms are like a lot of things.
Bloating, abdominal distension, maybe frequent urination, sometimes shortness of breath, sometimes either weight loss or weight gain. They're very vague symptoms.
Since the symptoms are often hard to recognize, Dr. Wender says early detection is key. That can include routine pelvic exams and looking at family history. How often you get that depends on your risk factor.
Women who have a family history of ovarian cancer, women who have a family history of breast cancer may have a higher risk.
Dr. Wender says some women at high risk choose to take out the ovaries, but he says even if you do that, you can still develop a cancer similar to ovarian. He says the process to surgically remove the cancer is extensive.
Taking out the ovary, the uterus, sampling lymph nodes, looking at the diaphragm, because ovarian cancer tends to form little implants within the abdomen. They'll take those out.
So how does he prepare those patients?
Get to the surgery, get the chemotherapy done. Then I do tell them that there's a high rate of it coming back, but not everyone comes back.
Dr. Wender says if you are experiencing symptoms, you should contact your primary care physician or gynecologist. For HealthBeat 4, I'm Michaela Feldman.
Dr. Wender says the survival rate for stage 1 is very high. Stage 2 moves to around 80%, but often the survival rate drops to 5 years.